maybe since you found some pretty good shit in the hamstring, maybe you hit the hamstring on both sides.
Yeah, we do hammies. We can do like hips.
The
Go
main
back
thing
into the
that
heel.
hurts right now though is my neck has been bugging me a little bit. You worked on that a little bit last time, and my shoulder. So the rest of me is fine, but
What's
if
going on
we
with the shoulder?
so it was bothering me kind of more back like the rotator cuff type stuff. You fixed a lot of that. Most of that's gone. But what I noticed was when I do like a front raise, that there's almost like a glitch, like from here to here. There's some.
Does it hurt? Like, so bring it up. Don't just resist me. I'm gonna bring you down. Okay,
Yeah,
resist. Does that hurt?
yeah.
Okay.
No,
Or
not really. But
not?
yeah, with some weight. Yeah.
How about going down? Resist.
No,
No. How about out?
a little bit.
A little bit. In.
In's fine.
Yeah. So it's mostly with some weight. You said probably
like a
under
30,
load. It would be a
you know,
little
like a
okay.
30-pound dumbbell or something. It's
Okay.
like right there. There's just a little bit, and so I'm like, oh, okay, it's probably because I think you cleared out most of the.
Yeah, we did last time. We hit like shoulder, chest, got into like the subscap area. That should probably do it today too. That should probably help.
But I think like 2 days later, I went and I did 315 for like a set of 8, and I haven't done that in forever without a slingshot. I've been mainly using a slingshot because my shoulder's been weird.
Yeah.
Which way?
Let's go face up first. Let's do the shoulder.
Still
Left side, correct?
Yep.
Okay. Yeah, they'll figure it out, bro. You doing any running today?
I probably will. Yeah. Probably get some running in today.
Dude, when I saw that post, I was like, I'm about to run through a fucking brick wall right now. Like this dude Mark fired me up.
Yeah, I was pumped.
Oh yeah.
Yeah, I even been able to do some sprints and stuff, sprinting some hills a little bit.
Yeah, I seen that. I haven't been back to UC Davis since like the whole remodel, but I saw that you were out there. It looks pretty nice, like that right there by the lake, or like by like the water that they have, you know?
Yep.
The little hills right there.
Yeah, the Arboretum looks awesome, man.
Yeah, dude.
I went to UC Davis, their stadium, and I did some stairs over there too, and that was awesome.
Yeah, this weekend I was doing my last long run, and I stopped by Sac State, and right by the tennis courts, they have a parking lot. The stairs, dude, just from the very tip top bottom to the tip top, it's like 6, 7 tiers, I think it is.
Oh, nice.
Nasty, dude. So I was like on mile 5 or 6.
How long does it take you to go from the bottom to the top? It's like 60 seconds, 90 seconds?
I'd say closer to 90.
Yeah,
that was like
good.
I was at a good pace too. You just feel that lactic acid build up in your legs, like damn.
Yeah, there's like almost next to no good hills in Davis at all, but there's one overpass where there's some pretty good, and like one of them takes me about 3 minutes to run. What are you doing here? Because you're like moving my arm and you're digging in.
I'm trying just to kind of see where your movement is right now, right? I did some warming up on the chest and the shoulder, but here I'm just trying to pin down the shoulder, move your arm, and see where the range is. That way when I work on the bicep and the shoulder itself, I can retest it and see if what I did helped, you know?
How can you tell, like, what's the end of someone's range? Like, what are some cute...
So as I'm pushing you, so here you can see kind of I'm pushing down on the shoulder joint, and then I'm using my leg to kind of push you up, get you in this position. The higher
that's your leg?
Yes. The higher I go, I can kind of start to feel resistance right here by the chest, right? So that's how I know. Oh, that's his end range right there.
And
right?
on me, it's probably more obvious.
Oh,
but
you're rough, dude.
On some other people, it's probably like,
right. And
some people can move their arms.
Oh yeah, absolutely.
Crazy,
There's
right?
some people that like I do that maybe 1 or 2 passes, and they're coming already all the way up, right? So maybe I'm like, hey, maybe I don't spend too much time there, but let me just check it, right?
I see.
That way, when I do move on to the next body part, I can kind of compare the two, right? In this field, man, it's really important to kind of test and retest as much as I always tell my therapist, like, test and retest as many times as you want, man, right? Like, why not? Why should, like, what we're trying to do is we're trying to give you a mechanical advantage, right? By changing your tissue quality, right? So if I'm trying to change something very small or big, whatever it might be, why wouldn't I retest it?
Right.
Right? And it doesn't have to be like, hey, Mark, let's get up and have you perform a movement. Nah, it's something very small, right? I can move you, and I can kind of test that, right? Test the tissue quality, see how it's moving. So here we'll kind of do a little bit of a pin and stretch. Same thing, trying to pin down this chest and then move that shoulder. Feeling all right?
Yeah, it feels great.
Cool. What you about to hit today, man, for your workout?
You know, I don't know, because like the way I've been training lately, it's like I have to sort of figure out like what haven't I done. So I'm like,
You just kind of been doing like
I'm like what haven't I done?
freestyle, like freestyle
Yeah.
type workouts.
Yeah, because I've been
That's cool, man.
working out pretty hard recently.
That's awesome.
But yeah, I did a bunch of stone lifting yesterday. Trying to get better with those. I just realized my core is really weak with weight in front of me, and I never really. I remember when I was.
I mean, that makes
powerlifting.
sense. That makes sense, though, right?
It does,
the further
but never-
away from center of gravity, right? Like,
Yeah, and it makes sense for me. I mean, because I would squat, right, and the weight
Yeah.
would be on my back. And a deadlift, you're trying to like leverage to be as close to you as possible.
Right.
And so yeah, I'm like way weaker there than I should be. So I've been doing some like weighted carries and stuff. And like I have these medicine balls that are pretty big. And you saw it when you were at my house. You saw the stones and stuff.
We actually got to play a little bit with them, man.
Yeah,
I'm pretty sick.
yeah. Farmer's carry.
Uh-huh.
Yeah, I did a.
I think people
farmer's-
underestimate, like, just simply, like, I mean, it's kind of an unorthodox way of training, right? A lot of people, they train with kettlebells, with dumbbells, with barbells. Like, picking up a large stone was like a crazy workout. Like,
Yeah, picking up a rock.
yeah.
And even just I think walking with stuff I think is huge. You know, like you grab like a 15 or 20 pound kettlebell and just like walk around your block with it
Yeah.
and just hold it and press it, and it's like kind of fun. Half fun, half annoying.
Okay, so now, as I retested that, there's no more pull much here at the chest, but I can feel a little pull down here, right? So whether that's tricep maybe, or maybe that's your subscap here. So we'll get into the subscap, and then we'll retest it and see how it feels.
How'd you get into all this stuff?
Oh, dude, I have your typical story. I ended up getting hurt in high school, busted up my knee. When I was going through all my recovery, I had a shitty PT. So he was able to get me back to walking, but I never really got back to sport. And yeah, went to another PT. He ended up doing a lot more manual work than physical work, like physical therapy. And the manual therapy just really opened me up. And I remember hopping off the table and I was like, man, like
What's that?
what did you just do? Like, you spent like 30 minutes on my leg, like.
Right.
And I got off the table and I was like, I want to do this.
Right.
Like, I want to help athletes get back to feeling like this. You know what I mean? And it was crazy because at the time I was in college, kinesiology major. I actually was going with the strength and conditioning background, and when I got hurt and then started doing all the physical therapy and manual therapy, I was like, I want to switch over to like the recovery side of it, you know? But it's cool because my first 2 years in college, like I was getting that strength and conditioning background, which was awesome because I can kind of do both now, right? Program for my athletes to do some corrective exercise, but also just do all the manual work and help athletes, you know?
That's cool.
So I have your typical story, man. Got hurt, experiencing myself. And that's actually one of the best ways to like become a perfectionist in your craft, right? Like you actually feel the stuff, right? Like me, like I got hurt. Then I felt some manual therapy and I was like, holy shit, this helped me out so much, you know? Learned under some of the greatest, Dr. Lesher from UCLA, Mike Stella. If you guys know who Mike Stella is, like the goats, man, the goats of manual therapy.
And Dr. Andy Galpin was your professor.
Dr.
too.
Galpin was my strength and yep, absolutely. Down at Cal State Fullerton. That's what it is, man. It's just about being around the people. And Mike Stella always says that be in the room with those that you want to to essentially like be, you know.
Right.
Mike Sella always talks about that, like be in the room.
How does somebody do do you have to have a license, or like how does it work
Yeah,
here in California?
yeah, so you know, you can get away with doing manual therapy just with like massage school. Massage school is typically about a year. People can get their massage license because you do need to have a massage license to, you know, legally do this.
All right. To do it on the up and up.
Right. But yeah, so massage school touch the base on like, you know, the anatomy and how to actually massage. But to do something like this, like manual therapy sports work, you want to learn under somebody, right? So you want to learn someone like me, someone like Mike Stella, someone like Dr. Lesher, right? And I think Dr. Lesher is actually a athletic therapist who does manual therapy, right? There are a lot of PTs who do manual therapy. Me, myself, I'm a massage therapist, right? So you can go a lot of different routes. Mike Sella, he's also I want to say he's an athletic therapist that does a lot of manual therapy. But it really is about learning under someone that does it.
Yeah.
Right? And that feels a lot smoother now.
Yeah.
Right? We'll do a little bit of scraping right here.
There's a lot of tension in the back of my shoulder when you were bringing my arm over this
Across.
way.
Yep. So that subscap, you'll start, the referral points, you'll start to feel it kind of wrap around that shoulder.
Yeah.
And it really helps with like that overhead movement, right? A lot of you guys seen or have heard of the term frozen shoulder. Frozen shoulder is really when your body cannot move past. You can't do this essentially, right?
And you end up moving your whole body.
You ended up
rather
doing,
than your
not
shoulder.
even that, man. You ended up just doing this. Like someone with frozen shoulder does that, right?
Yeah.
Which is kind of tough. But essentially, this subscap right here just gets stuck. It stops working.
And the shoulder won't like move around.
It does not move. It's kind of crazy. Actually, I don't know if there's any studies onto why frozen shoulder happens. It's one of those like anomalies. Like it just happens, and once it happens, it actually has to go through 3 different stages.
You really wreak havoc on somebody, huh?
Right, and it's kind of crazy, man. Like this is the muscle that you want to make sure is nice and loose all the time. So with someone like you who has history of very heavy lifting, it's something I always hit on you just because I know it's gonna be a tight area, right?
Yeah, right.
Do a little scraping here. So here we're just trying to change. Again, kind of change that tissue quality, give him a mechanical advantage with the tool. Right, a lot of the work that I'm doing, like I do it, all the work is done with my fingers, my forearms, like that's where the work is being done. These tools are just tools, right? These kind of just help me get you to a better space, right, with the tissue quality. But all the work has been done with my fingers and my tools, essentially, you know.
Yeah, this feels really like gross. He said scraping, and that's exactly what it feels like. And you can feel
it's not pleasant.
You can feel like ropey material underneath there, and it's not all the time. Like when my tissues are better, to me it will feel less ropey.
Mm-hmm. Let's put these cups on.
Uh-oh.
Just get it.
Suction cups.
It's your favorite, dude.
Yeah, I'm always all marked up.
Mm-hmm. Isn't it crazy? Like, it's a great conversation starter, right?
Yeah,
like,
right.
What is that?
Yeah, it's good promotion for you.
Yeah, exactly.
I'm always like, oh, it's Oscar.
Go to my guy Oscar.
Yep.
I get people in here all the time. Oh, I just talked to Mark Bell. Mark Bell sent me in. Cool.
Yeah, I try to refer a lot of people to you. Because people like, you know, I can give people some basic information, you know. But I'm like, just go have someone
absolutely.
Someone take care of it for
Absolutely,
you.
Man.
And this is sort of like a blood flow type of deal.
Yeah, we're trying to. So with massage, we always compress the tissue, right? And with scraping, we're compressing. This is kind of decompressing that tissue and also allowing. It does increase blood flow, absolutely. But what we're trying to do is, again, we're just trying to give you a mechanical advantage by hitting the tissues in a lot of different ways, right? It's also a way to kind of get the tissue into its end range without having you move, right? Like right now, this tissue is getting pulled up so much, it's at its end range, right? But I can give you more an advantage by taking you into more of an end range, right? Which is why it feels a little bit pinchy, right? But when I take these guys off, your body's gonna use that. Your body's gonna be like, oh my God, we have more movement, right? So we'll take these guys off, have you kind of sit up, and see how it feels.
Yep.
Go ahead.
It already feels a lot.
I mean, amazing, right?
A lot more free. Yeah.
Ready to hit 315 for 10 this time.
That's right.
Oh, easy, dude.
Yeah, I just felt like really locked up beforehand.
Yeah, butter. Let's go. Let's have you go face down. I was gonna do some face up work on the neck, but let me have you go face down real quick.
All right.
That way we have you down there already, and we can get to the calf. But I am gonna work a little bit on the neck, and then also a little bit of the rear delt too. Okay. So go face down. Have your arm just kind of out in front. Let them fall.
Out here.
Right there's cool. Yeah, perfect. So here we're gonna work on these teres minor point, and you'll start to feel, Mark, a little bit of a, I wouldn't say pain, but discomfort towards the front of that shoulder, even down to the fingertips. Okay.
Yep.
Just one of those spicy areas here.
Yeah, I've had issues in that spot for a long time.
You and everybody else, man. Absolutely. I'm kind of warming you up here, and then we'll get directly to it. You doing all right?
Yep.
Cool. This one's not fun. Not fun at all.
How can you feel like if you're maybe just overdoing it on somebody? I mean, I know you get feedback a lot.
I mean, it's kind of hard as a practitioner to answer that question, because you see a lot of videos out there where like people are like squirming off the table and you know what I mean? Like, is it bad? Yeah, in my opinion. You never want, I mean, we're trying to release the tissue. You never want someone to tense up the tissue that bad, right? So I always ask, hey, how you feeling, right? Again, it should feel, hey, Mark, it should feel uncomfortable, but it shouldn't be too crazy, right? Letting you know that way you can kind of give me a little bit of feedback. Hey, that's a little bit too much. Or, hey, actually, I feel that, and I'm good right there, right? So I always just check in with my clients. I'm also kind of trying to read your body language. I know me and you, we've been working a lot for the last, like, 3-4 years.
Yeah.
So you have a little bit more of a pain tolerance, but with other clients, you know, I'm looking at, as I'm on these areas, are they like, you know, are they having happy feet, right? Like, are they like, oh, damn, like that hurts, right? Or are they moving their pelvis side to side? Like, people do different things, right?
The butt cheeks.
Yeah.
They tense
little,
up their butt
little
cheek.
squeeze, you know? So I'm just trying to read the body while, again, just talking to you. Hey, how you feeling? How does that feel? Making sure the client knows, hey, you might start to feel this, right? Because what if I push down on this area, you feel that tingle down to the fingertips, and you're like, what's going on? Like, he just messed me up. You know what I mean?
Right.
But, I mean, you see videos all the time, man, of practitioners just, like, having their clients squirm off the table, and I personally don't think that's a great practice, but it is what it is.
Yeah.
It is what it is. I'm sure you see a bunch of different strength coaches or trainers that you disagree with, right? But that's what happens in our field, man. Like, with sports, you have some disagreements, you have some agreements, and boom.
Yeah, I think certain areas are more resilient too, right? Like certain areas, I know, like you've worked kind of on my armpit before, and that's like crazy.
Or even for you, I mean, the calf.
Oh yeah, I hate
the hamstring, right? Like, but I think it's because you have a history there, right?
Yeah.
Like you've lifted your whole life, and you were heavier at one point.
Yeah.
And then you got into running, you know. So the body is just taking a beating in the last couple of years. But yeah, man, manual therapy is a lot about just connecting with the client, right? And as I always tell people too, like, if I get a new client, I'll tell them, hey, as we do more sessions, I'll get to know your body a little bit more, and you know, you could get to know me a little bit more, right? And that way we have that therapist-client connection.
Then you get like different, like your elbow and slash forearm versus your finger is just way different touch points, right? Like
a lot of different tools, man. That's what I'm saying. Like my tools are my fingers, my forearms, like my body weight, whatever it may be. But I'm working on your trap right now. So it's, for me, you know, just kind of looking at for myself, this is the best way I can get to the area, the problem area, without hurting myself, right?
It's also helping my neck and my shoulder, right? The first maybe a couple months you started doing this, were you really tired?
Like your arms
dude,
and stuff?
you know what's crazy? When I was in massage school, I remember going up to my to one of my instructors and asking her, "Hey, like, why are my abs like firing right now?" And she was like, "Well, you gotta think about it. We're holding these positions, right? Like right now, I'm working on your trap,
Right.
but my oblique is just firing, right? I'm
Right.
kind of here to the left, right? Should I be a little bit more stacked? Yeah, maybe, but you know, we it's kind of just what we do."
Yeah.
But yeah, dude, the first couple months, I would get up off of bed and I'd be like, "Oh my god, like I just got a sick like ab workout, you know?" But it's because we're holding so many positions. Also, your fingers, obviously, they get used to the work, your forearms.
Yep.
Through the years, you kind of learn body mechanics, how to stack your body, like I said, how to use your different tools, your elbow, your forearm, your fingers, all that. And then, as you can see, I like to tape up my wrist just to kind of keep me out of extreme flexion or extreme, you know, so it kind of just helps me. It helps me a lot more. A lot of therapists, you'll see them be in the game for about 3 to 5 years, and they don't last long because they're just beat up, right? And how are we going to help somebody if we can't help ourselves, right? Or if we're in pain,
Good point.
right? Not to say that I'm perfect, because I mean, when you guys walked in, I was on the slant board, right? Like I was making sure that I'm ready to go to war here. I usually do 3 clients in the morning, 3 clients later on in the evening. So in between clients, I mean, Mark, you can test to this. Like I'm always foam rolling. I'm always scraping my forearms. I'm doing everything to keep my body in shape to do this. I'm getting a little deeper here, okay?
Yep.
Doing all right?
Doing good, yeah.
Cool. So a lot of times when we have neck pain, it's attributed to this trap. And a lot of people forget, like the trap is huge. The trap comes from here to around the neck area, right? So it covers this whole spot, and then it goes about right there. So it covers this whole surface area, right? When people think of the trap, they think it's just this muscle here.
Right.
But no, it's this whole surface area. And of course, there are things underneath the trap that are there, right? Like we have our rhomboids. We have the lat attachment. The lats are pretty big too. The lats come here. So they are going to kind of overlap with these areas. But yeah, this usually when we have neck pain, it can be neck itself, right? Like some neck muscles. But a lot of times if we kind of just open up this trap, it's going to give him more range, right? More range of motion. And it'll relieve some of that pain as well. As I'm right there, Mark, what are you feeling? Anything up towards the neck or even up towards the head? Or is that staying pretty local right here?
It's staying pretty local.
Yeah.
Yeah. Some of the other stuff you were doing before, though, I felt it more into my, like, back of my head, my neck. Yep.
So this one, you'll probably start to feel up towards that head as well,
Yep.
okay?
Yeah. Yeah, that feels
Another
amazing.
trigger point, yeah.
Yeah, that thing's just stuck. I've always felt the same way about this kind of manual therapy, like the way that you felt. Like, you know, I had a different path fitness-wise and stuff, but, like, I've always wanted to share this information, you know, tell people about, like, these practitioners just because it's, like, I think it's exciting that you can go and get your body fixed.
Absolutely.
In a really short period of time. Sometimes one session sometimes can make a huge difference. And my wife said that a lot of times you'll tell her, like, all right, I just need to go through this one more time. She's always like, no.
Yeah. And you know what? That move, it's the subscap, man. And I mean, with swimmers, she's a swimmer, obviously, so she needs that movement, that range to be able to go over the head and pull that water back, right? Especially when she's doing those crazy open water swims.
Right.
But yeah, I'll tell her, all right, last one. And she's like, let me breathe first. You can't redo because after the first one, I'll punch back.
Have you had some clients to where you just sometimes have to say, hey, you know, you got to get like MRI, you know, like
absolutely.
You might have tore something.
Absolutely,
you know?
Absolutely.
Because I think people think that you can kind of fix anything.
Absolutely. And I'm not that guy to just take your money. Like, I'm gonna be honest with you. Hey, my job is to help you as an
Right.
athlete. And and don't get me wrong, sometimes it sucks that I can't help people, but sometimes it happens. I can't help you. So I'll refer out. I'll tell you, hey, maybe you get an MRI, get this, checked out. I've done 2 or 3 sessions with you and you're not getting any better, right? Or it's, hey, we're providing some pain relief, but we're not fixing anything, right? And like I said, very, very seldomly would I have to do that, but has it happened? Absolutely. And I'm not going to sit here and tell you, oh, then, you know what, let's do 10 more sessions.
Right.
And let's see how that feels. Absolutely not. Like, that's just, in my opinion, it's a waste of money, right?
Yeah.
And if I don't think that I can help you in the long run, I'm gonna tell you that. I'm gonna be honest with you. But very, very, it's happened maybe, I don't know, like probably counting on my fingers, right?
Right.
And sometimes the client is cool with, hey, you know what? I have some pain relief for 2 or 3 days. It lasted 2 or 3 days, but I haven't had that pain relief in years. So I'm okay coming in here and just getting that pain relief, right? But then I will say, like, hey, I'll gladly keep working with you, but let's try to refer out and see how we can get you better, right? Let's make that 3 or 4 days last months, years. Maybe we stop the whole pain in general.
What about the some people get kind of caught up on the terminology, and some people say there's no science that shows that you're like getting rid of a knot,
Sure.
but like you are somehow helping people. So like, what do you think is going on?
So this practice has been around for years. Cupping, scraping. It's an old Chinese practice, right? Centuries. And I think in the sports world, it's been around probably, I would say Michael Phelps had a lot to do with this type of work, right? The whole cupping, the whole deep tissue. So what was that, 2008, 2006, right? So that's fairly new. In the world of recovery, 20 years is fairly new.
Right.
So I would say a lot of people just take time to kind of warm up to new things, right? So like we see old continuums in sport, right?
Right.
So for example, the whole icing over heat or compression elevation, like that is proven to help. But the ice thing as of lately has been kind of up in the air with, do I ice or do I heat, right? Is icing helping me or is icing making me worse?
Right.
Same thing with manual therapy. Like I think this is all newer. And as it kind of gets more light into these like athletes' world, and we show that it is helping athletes, it can absolutely help you. Is it always the answer? Probably not. But can people utilize this type of work? Absolutely, and it's proven. Right, out of 100 clients, I'd say I'd probably help 90. Right. 10 clients that maybe. And you also got to think about this. It sucks to say, but in the fitness industry, people want everything now, right? Hey, I want to lose 50 pounds now.
So what you do has worked so well for me that I haven't seen you for months sometimes. You know?
Right.
Like I don't always really need it. It is nice to have the maintenance.
Right.
But sometimes my body just, I'm like, you
feel good. Right?
Yeah, I was like,
I saw Oscar a couple weeks ago, and I probably don't need to see him for another 2 or 3 weeks. Yeah. That's awesome. Great. That means that we made a change in your body, right? But, yeah, man, a lot of people, like I said, they want stuff now. So they want to get fixed now. Well, hey, lady, you've been dealing with this pain for 2 years. How am I going to fix you now, right? I can make you better. It's going to take some time. But let me show you that it's working, right? And unfortunately, some people, they'll continue with us. Sometimes they won't, but...
What was that spot you were just on? Was that teres minor?
So that was also teres minor, teres major. Yeah, same area that I was on this spot. But I didn't work on the front shoulder on this side, which is why you're probably feeling it a little bit more on this side here.
Yeah.
That's why you kind of do a little shimmy, a little shake.
Yeah,
so you felt that a little more, huh?
I was kind of surprised. Like I didn't know that was there like that.
Yeah. I'll get you here. Drop that elbow right there. It's perfect. Yeah. I mean, before I met you, I don't know if there was if you did manual therapy before or like how often you would do it, but like How often would you do massages, or would you do like foam rolling, stuff like that? Like, or when you met me, was that really the first time you kind of did recovery for yourself?
No, I've been into this stuff for a long time.
Nice.
Like I learned about active release therapy probably around 2000 or so, and I just was real fascinated by that. I remember it came out of Colorado, and Dr. Leahy, was doing that kind of stuff in kind of the 90s, I think.
Yeah.
And
it's been around, man. It's been around.
Yeah.
People just...
And he had real specific technique, He was like, moving the arm as he pinned something down, and
some active release.
Exactly, yeah. And so, I was fairly into it. And then I went to a guy when I lived in L.A., and it would be like, I want to say it was like $30 or something.
Nice.
And, the guy was a chiropractor, too.
Okay.
So the guy did chiropractic. He did, like, all this other stuff. And... he got done with the session and working on me, and I didn't have shit back then. I didn't have any money, but he's like, yeah, it's $30. I was like, what?
Cool.
I was like, it's only $30.
Run it.
He goes, some people get mad that it's $30, and I'm like, no, that was amazing. Like, I was like, I was so excited by it, and I just thought it was really cool, and I have always tried to promote it to other people.
Yeah.
And they're like, they'll always like, they don't understand like what, because for some reason the word's still not out on this stuff. Mm-hmm. Like it is in our community, but then outside the community, it's not. I mean, my dad comes to you,
I mean, going back to the whole old continuums, right? We still have a bunch of chiropractors and doctors who are in their 50s, 60s.
Right.
So when they were in school, they learned this way, right? And maybe they are not open to what we are learning in school, right? I'm 28, so when I was in school, the doctor for the Kings or the Lakers, like they learned a whole different side of sport, right? A whole different side of their profession. So I think it really just has to do with, in sport you see all the time, and in fitness you see all the time, like everybody evolves, right? And when you stop learning, you're kind of just putting a stop to your career, essentially,
Right.
That's something all my like professors have always said is never stop learning.
Right.
And maybe you don't agree with something, but take a little bit from it. Hey, I liked what this person said, but then I also like what this person said. Let me put that into my beliefs and see what it forms there, Or with manual therapy, like I can teach you how to do this, but maybe you don't agree. Oh, you know what? I'm gonna switch up my flow a little bit than Oscar's. Cool, do it. It's always evolving, man.
How long you been doing it for?
I've been doing this now for 8 years. 8 years. I've been out in Sacramento for 5, and it's been great. It's been awesome. But I started off down in Santa Ana. I was working with Pitbull Torres, and you've had Pitbull on the podcast before, so
yep.
You guys kind of talked there. But yeah, man, I was out in Santa Ana, freshly out of college, Cal State Fullerton, and I got connected with Pitbull Torres, and this was around the time where he opened up his gym in Santa Ana.
Yeah.
He hit me up at it was a random Friday night, 7, 8 p.m. He was like, hey, can you come out here and do some body work on me and the team? And I was like, absolutely. So I went out there, and that's kind of how it started. He started, he's a big YouTuber too, so he was posting me, and then word of mouth, and
oh, cool.
That's kind of how it took off, man. Great. Let's start getting to that hammy and the calf. You doing all right?
Doing good, yeah.
Awesome.
Yeah, that felt really good. Sometimes you just feel like you start to become part of the table. It's like, oh, your face.
Move your neck around, see how that feels,
Yeah.
man.
Yeah, it's feeling a lot better.
Yeah.
Yeah, it's just had a stiff neck going on for
Yeah,
a while.
yeah.
Super annoying.
We'll finish it off with a little bit more of active release on the neck, but let's get to that calf. Take your time, man. Take your time.
Yep.
All right, so this side is usually pretty sensitive for you, so we'll kind of warm it up a little bit more. And this is the problem side that he's been dealing with.
It has been, yep.
For a while now. It stopped him. It stopped him from running.
Yeah,
it stopped him from a lot of different things. Huh?
8 months.
8 months, man.
Yeah, I had to even like not do the sled as much. I had to even like reduce some walking and all that stuff.
So a lot of it is just mechanics, right? Like I said, Mark has been, I mean, if you guys been following Mark Bell for a while, you know how big he was, right? And that's because of the load that he would have to put on his back, or the load that he would have to carry when he was benching, whatever it may be. But when he started getting into running, you can't forget that he was powerlifting for many years. So his body is so used to kind of being in that stacked position to hold all that weight. So when he's getting into running, his body mechanics just weren't really there, right? Yeah. And Mark, you did everything. Like, I mean, you were working with the GOTA dudes, and a bunch of different people to help you with that, right?
Yeah, still paying attention to it the best I could.
Absolutely.
Yeah. But my body only moves a certain way, you know.
Although it's improved, I don't think it's where it needs to be, right?
No.
Which is why we started seeing this like injury here.
Yep.
Also, you just have a tight hip.
Yeah.
So that's gonna affect it, right? But again, going back to the whole, it takes time, right?
Yep.
For years, your body was so used to lifting heavy ass weight. Then all of a sudden, you drop all the weight. You're still working out, but you're doing different types of workouts.
Right.
You started throwing running into it, and that's a whole different type of workouts, different stimulus for your body.
Yeah, and this foot on this side, like, it tends to want to point out a little bit more.
It's a hip.
Which isn't necessarily the worst thing ever, but my toe points out, and then my foot will collapse a little bit more on this side than it does on the other. So.
But over the years, man, I mean, since we started working, so Mark and I, what year was it, Mark, when we ran the half marathon together? Was that 22? 23?
Yeah, probably 2022.
Man, that beginning running Mark to where he's at now, I mean, he's doing sprints now. Like, you've seen videos with him and Nsima, like, going on the overpass. Like, it's crazy, man, how far you've come, you know?
What are some of these muscles you're working on?
So right now I'm just on the gastroc, the gastrocnemius, and it's the biggest calf muscle, right? And people forget too the anatomy of the gastroc. The gastroc actually passes the knee joint, so it's very important that we get to this right here, and that kind of hurt. That kind of sucks, right, Mark?
It does. Yeah.
We have a lot going on right there, but yeah, this gastroc kind of covers this whole calf, and then it starts to split. And when it does that split, there's a lot of different areas that we can get to, right? So you'll see me when I run my fingers through one side, or I'll kind of lift the leg and I'll run through this right side here, the inner side. If we start to change the angle, right, I can come here and get to the soleus. So it's very complex. The body is very complex. But right now, what we're getting to is just the gastroc. And the reason for that is because I want to open up the gastroc. I want to make sure that this Achilles tendon is nice and open, so that when we get to this heel, it's money.
You ever see that study with the, like, basically someone just doing seated calf raises throughout the day?
No.
It, like, raised their metabolic rate by, like, 40%.
Really? Just doing calf raises?
So somebody just, like, sitting at their desk, just doing not like pitter patter in their foot. You know, some people do like the nervous thing.
Yeah.
Not like that, but just slowly.
Like actual slow. Yeah.
Yeah, slowly
actual
doing
reps.
like a seated calf raise almost. And I guess what they found is that it basically, in some weird way, simulates walking. So they think that like one of the main benefits of walking is the activation of the soleus muscle, or the gastroc, I think it was.
And the gastroc is it's a big muscle. It's a big muscle.
I think it helped with like their blood glucose levels and everything, just by like, rather than like just sitting at the desk not really doing much, just working.
You've seen people nowadays have the little walking pads.
Right.
I think that's a game changer, man.
We
always hear the excuse like, oh, I don't have time, right? Like I work for the state, or I work for the government, whatever, 9 to 5. And then I come home to kids. I don't have time. Well, like that little walking pad just allows you to move throughout your day. Like that's
maybe it's not super convenient all the time, but you just do it when you can. You know?
Why not? like you said, it's something that you weren't doing before, right? As a massage therapist too, very important that you kind of lay off this area here. I said earlier, go all the way up to cover the whole gastroc, right? Because it passes the knee joint. But we also have our popliteal artery in that area, so don't want to do no damage. So I'm kind of laying off in this area. I am getting to it, but I'm laying off. Doing all right there, Mark?
Doing good, yeah. There's a lot of like weird like tendons and shit in there too, so it starts to feel pretty gnarly.
Yeah, that popliteus muscle is very small, right? Helps kind of unlock our knee. But that popliteal artery that runs here, man, it's very important you don't hit any of those areas. So make sure you know what you're doing.
Yep.
Cool.
Nice.
Let's get a little scraping there. Be a little fun. So this is also a scraper. You see this one's a little bit more gnarly looking, right? But we have a couple of them. Mark, do you have any scrapers at home?
I do, yep.
Yeah. There's also this one right here, right? A little bit of a hook. And then I usually use, this is my favorite one, the leaf, right? But there's a lot of different scrapers that you can use depending on what tissue I'm trying to get to, or depending on the tissue quality that I feel. I'll use a different tool. And right now, because I'm standing on this left side and I'm working on this right side here, I think this one is just best for me to use. It's not that serious. You can use whatever tool you want. But going back to body mechanics for myself, this feels good for me. It probably sucks for Mark, but I'm trying to help you out, man.
Yep, it sucks. Go to Oscar, it sucks. That's my quote.
People are always like, man, I pay you to do this?
Yeah.
I pay you to torture me? You
Get
do.
the shit beat out of you.
You do. Dude, very unfortunate what happened to Fred Warner, huh?
Yeah, man, what
You
did
saw
happen
that?
to him?
He ended up, I think they confirmed it was a ankle dislocation, but because of the dislocation, obviously it tore some shit in his ankle.
Oh, man.
But it looked horrible, man. The Niners are just
Yeah, they're getting hurt
dealing
left
with
and
all
right.
these injuries. It's crazy.
I never heard what happened to Tyreek Hill, but his looked
Oh,
pretty
he
gnarly.
dislocated his knee.
But he's going to be okay, huh?
No.
Oh.
So usually when you dislocate your knee, going back to the popliteal artery, when you dislocate your knee, a lot of things can happen, right? You can tear all the different ligaments, right? MCL, PCL, ACL, all that can tear. But then also, we can actually do damage to this popliteal artery, which for him, I don't think happened. I don't think that was the case. But because of the damage that occurred, I think he's looking at probably like a 9 to 12 month recovery, man.
Oh, wow.
It's horrible. It's a
So
horrible
it's a little
injury.
bit like oh shit, what was the guy on the 49ers that used to play for the Hurricanes? McGahee?
Yeah, Louis McGahee. Yeah, so he completely dislocated his knee as well. If you go back to, that video was nasty, man.
And he came back, though.
He came back.
Yeah, and he did pretty good for a few more years. And then I think he ended up with the same injury again, though.
Mm-hmm. Twice. I think it was the same leg, too, which is crazy. But, a dislocation is pretty bad because it can come with all these different tears. So in Tyreek Hill's situation, I think he didn't do any damage to that popliteal artery, but I think he tore up his knee pretty bad.
Damn.
What do you think about that, man? Like those injuries in sport. Do you think it has to do anything with like the strength coaches or like the recovery, or is it just like a freak? It's a freak play, right? Like,
well, the contact injuries, they're contact injuries, and there's not a ton you can do about those things.
I do think that some players could maybe be in better shape.
Yeah.
And then if you're in better shape, you're not in the wrong position. You're
Yeah,
in the
likely
right.
to- yeah, likely to
you're
get
in the
less
right
hurt.
spot. You know, but Fred Warner's in great condition. A lot of those guys are, you know, Tyreek Hill. It's not like he's out of shape. You know, he's in
Right,
great
right.
shape. He's very physical. So the contact injuries, I think there's less you can do about those. But the non-contact injuries,
Like in basketball, right?
yeah,
Like
I think a lot of it does
past
have
year.
to do with like the way they're trying to train and all that kind of stuff. I think they need to get these guys to move better, and they need to get to move better at younger ages. I think, especially basketball players, they're so tall, like their body's like kind of complicated. How to kind of like manage when you're 6'8".
Yeah.
You know,
They're freak athletes, though, man.
freak.
They're freak athletes.
Yeah, I know
They're-
you worked on the Kings and stuff.
Yeah,
right?
man, it's crazy. Like someone like Alex Lynn, right, who's just absolute 6'9", 6'10" beast, and he's moving around different directions, dunking the ball, right, whatever it may be. Or like Malik Monk. Malik Monk is one of those like springy guys, and those springy guys, they get hurt less frequently, but they're more susceptible to get hurt, right? Because
Yeah.
they're jumping, they're fast, they're running, they're changing speed, changing direction.
They're like ballistic.
It's crazy, man.
Yeah.
Those basketball players. Have you ever seen the picture of Jaylen Brown, who plays for the Celtics, next to Jalen Hurts? Jalen Hurts is he's a unit,
Oh yeah.
but Jaylen Brown like towers over this dude, and he makes Jalen Hurts look small.
Crazy.
It's crazy.
It's feeling good. I mean, it's tight and there's shit going on there, but it feels good. You know, one thing I'll say too is like, it's hard to do this on yourself.
Oh,
You know,
absolutely.
like I can do stuff to myself, but I'm not going to put myself through the pain the same way that you're going to be able to do it, and leverage and angle and everything you can get.
But notice how he's uncomfortable, but he's not squirming off the table, right? We're allowing the change to happen. Good. Nice.
Yep.
All right. Couple cups there. Call it a day, dude.
Man, this guy's crazy. On the way out, I'm going to tell him to revoke your license, or at least think about it. That guy's crazy up there.
Start talking all this crap as you're leaving.
Yeah.
Never go to Oscar.
Yep.
Good. This is rough, huh?
All you can do is laugh.
Good. All right, I'm going to give you a little resistance. Do probably like 20, 30% of a hamstring curl, okay? Go ahead. A little
Oh,
more.
that's really hard to do.
Go ahead. And relax. Good. Go ahead. Go all the way up. Go. Keep going. Keep going.
Holy shit.
And relax. Good. Awesome. All right, brother.
Man, that was pinchy.
Take your time getting up.
Holy shit. It was so hard to flex my hamstring.
It's crazy, right?
Yeah.
Do it now. Flex it now.
Oh yeah, it feels a lot better now.
Nice, right?
A lot easier now. Yeah, those little suction things he puts on me, it takes your skin and it basically kind of goes like that to it. Mm-hmm. You know, it's just, and I think all this outside stuff I think the stuff underneath kind of follows it. You know, like when you twist the skin, and I think it's like maybe not as deep as like when you're right, when you're like it's more surface level. But it's like the combination of like everything he's doing. Like he's getting that direct elbow every once in a while. Every once in a while it's like direct thumb, and then every once in a while it's like the full forearm, right? So it's kind of the combination of all those different pressures.
Just different stuff, right?
You know, this, right? Versus sometimes like in the beginning you notice like he used a lot of that. which is like that's not a blunt object, right? That's like a more surface area, you know. And then sometimes he's coming with the heat.
It's just like working out, man, right? Like you can't. There's a lot of different variations, right? For like bench press, right? You can do an incline bench, you can do a decline, you can do a flat bench, right? Same thing with body work, man. It's like a lot of different variations to get to the end goal of better movement.
Right.
Right.
All right, man. Well, I need a lot of help.
Yeah,
and this is the guy to come to.
Yeah, you do. If you guys ever want to come to me, AIM Sports Recovery, we have 2 locations, Sacramento off of G Street, and then we're off of Grant Line in Elk Grove. Both locations, we have more than one therapist, so if you can't get in with me, get in with our guy Rodrigo or with our guy Gonzalo.
He's been fixing me. He's been fixing up my wife. He's been fixing up a bunch of my friends, a bunch of my family members. This is the guy to come see, Double O,
Appreciate
Oscar Olguin. Did I get it right?
Almost. Olguin.
Oh, there you go. I'll leave it to him.
Yes, sir.
I'm too white to be able to pronounce
Yes, sir.
that.
Yeah, you are.
Strength is never weakness. Weakness is never strength. Catch you guys later.